The reason I didn't ask the question, I knew the Owasso answer, and we didn't talk about promoting and spending money to promote our facility. And this time we talked about money promoting the use of our
$800.
I understand.
Okay.
Commissioner Rettman.
Well, Mr. Chair, again, you've got principal being paid out of this budget, principal and bond payments of about $100,000 annually. But you also have a reality that the reason why Lake Owasso and the I still call it the Ramsey County Nursing Home, we've always had a better mousetrap. And I don't think it's bad to have a better mousetrap. In other words, we've beat a path to the door because it was the best. We've always historically had a great rating in both Lake Owasso and the nursing home. And so therefore people was there. I think with the advent of, the state has been on a race to the bottom with nursing home. At the same time, it's counterintuitive when the escalation of senior population and or those who are going to be needing specialized service may not be able to be accommodated in home, and long-term care is not the end-all be-all of covering all the cost. We also have the factor of in 2014 some of the medical changes that will happen, how that will impact.
That's true.
Do you know what I mean? And I think we've got to be looking at that, and that's why I'm saying is that if we want to be the best, and I think that's what we have, but the reason why we're the best is we also have a lot of long-term employees that have literally, been there and done that and are some of the best. We also, in the nursing part, long-term, not the short-term care, but the longer-term care is some of the patients that need the most extreme help. Do you know what I mean? And so that's what I'm saying. It was a niche that Ramsey County started playing many years ago, and all of that. So but what I am going back to is Commissioner Reinhardt, excuse me, originally said, I don't think any of the reductions in FTEs are that you're not laying off anyone, but yet there's still five and a half FTEs, I believe, most of which are in the nursing component. What I wanted to hear the answer is, when she was asking the question, can we get along without those 3 nurses?
Mr. Chair, Commissioner Rettman, related to the 5.5 FTEs, one minor correction. There is a reduction of the 5.5. The 0.5 is in our activities area, and that is a reduction of hours. So per contract language, that would be a reduction, and but the other 5 positions are by attrition. We had a retirement here recently. We're not going to fill the positions. To answer your question, Commissioner Rettman, it would be tight. We feel we can do it. As you indicated, we've got great staff. They're willing to step it up. There's no doubt in my mind, but for the purposes of this budget and trying to put something forward, that was our best guess estimate. If I could, Mr. Chair, Commissioner Rettman, just have one little additional piece here. When we looked at this budget and the shortfall in the revenue, we also, as we see here with the increase in the levy dollars of $555,000, if we were to truly balance this budget that's proposed before you today, those, to use our governor's term, would be draconian cuts. We went as far as preparing an additional budget where we'd have to, in that case, take 20 FTEs out of our budget. That would be painful. That would put us in compliance, substantial non-compliance on the regulatory side, and the attitude in working with staff is we might as well close our doors. We could not function at that level if we took out those additional FTEs. So that would result in layoffs. That would result in care and services be affecting, and ultimately our reputation as a quality provider. So that was one side if you truly were trying to just balance it. So going back to Mr. Chair and Commissioner Bennett's comments, could we do it? Absolutely, but it would be extremely painful, and we'd have a multitude of problems.
Mr. Chair, just to follow up, so is this sort of your vacancy factor? Since I'm still on that kick from yesterday, I'm going to keep on. So were these sort of all vacant positions? Were they vacant the past year or two?
They've been in the...
I know you've only been there a year, but go ahead.
Excuse me, Mr. Chair, I'm not following protocol here being a rookie, but I apologize.
That's fine. We're a little loose here, and with her, we're very loose.
Commissioner Rettman, these were open positions,
For the past year.
positions that had been vacated. Of the 5.5, 5 that we just felt that we didn't have to fill. But the 0.5 in activities is proposed as being a reduction in hours involving one staff person.
And that's Mr. Chair, that's like a $25,000.
Correct.
Okay. All right, thank you.
Any additional questions?
Oh, I didn't think he was done yet.
Well, I'm moving him right along. Any further questions? Steve? Nobody? Thank you. You just got out? Who wants to take a break versus go through the next one? Steve, you have a last comment you'd like to make?
Oh.
Mr. Chair, Commissioner Bennett, if I could, I would just like to close with a couple of comments.
Sure.
First of all, and going back to Commissioner Reinhardt's comments, I greatly appreciate them. Coming new into the facility, obviously, my mode has been to look at operations. We looked at the clinical process and that. I'm pleased to report to the commissioners and the county manager that during this past year, we have jettisoned our point-click care, which is the clinical software program at the care center, through assistance with CHS getting the IT support that we need to move that forward. That will help us with clinical charting, reimbursement, better accountability with our staff. We're looking now at, within our dietary department, what more could we do for our residents to enhance their quality. We've got a study underway, and we're projecting to kick out a 5-meal plan here yet this fall. And what that basically means is that residents have choices. They get 5 meals throughout the course of a day, like a light continental breakfast, a brunch, a lighter lunch, a little heavier evening meal, and then a supper. So that's exciting. We're excited about that. It offers more choice. We're looking at creating a preventative maintenance program. As I indicated, we're also looking at heightened fundraising efforts to jettison our foundation and to assist in generating more funds. We've already talked about maybe opportunities in the business line. I've got all sorts of ideas, all sorts. And then finally, next week we are having leadership training, which in my estimation is direly needed for our directors to make sure that we're equipped at all levels, that we're doing the best we can in the future and for Ramsey County Care Center. With that, I will close my comments. I want to thank Director Martin, County Manager Kleinschmidt, all of the BNA staff. Director Martin or Merkins, your staff have been invaluable to me. Thank you. And to all the commissioners, thank you for allowing me to be of service to Ramsey County Care Center.
Thank you for your comments. It was very nice. Okay. Oh, okay. I think I've got my message. We'll take a 5-minute recess. That was a nonverbal message I got. Tricia, welcome. The floor is yours.
Mr. Chair and Commissioners, good morning. I usually start by having a discussion with you about what we're seeing in terms of
Can you speak up into the microphone? That might help a little.
what we're seeing in terms of the resource room and that kind of information. But the county manager's office has done a really good job through the process of shutdown of pulling all of that information together. So I'd probably be repeating. So I'm just going to cover some other kinds of information that I think might be interesting to you and that might be a good backdrop for the discussion of Workforce Solutions budget. The first thing is that Minnesota's unemployment rate as of June was 7.2. Ramsey County's was 7.4. We're usually a little bit behind the state. For some reason this year we are not behind the state. These are not seasonally adjusted rates at this time. Regionally, employment growth over the past year has been seen in leisure and hospitality, which was up 4%, professional and business services up 3.6%, education and health services up 2.6%, and manufacturing up 1%, which was a bit of a surprise to me because we've seen a lot of movement in the manufacturing area, particularly with our Renew program. The majority of the hires that we've had have been in the manufacturing area. My guess is that that would indicate that the hole was pretty deep to begin with, that even though we're seeing dislocated workers and others getting jobs, it's only showing a slight uptick. Ramsey County maintains on average just fewer than 272,000 residents in the labor market this past year, and that was down from 273,000 the year before. There was an average of 19,930 unemployed residents in Ramsey County, and that was from last year, and that was down from 21,600. During the first half of this year, the average monthly unemployment for our residents was 18,000, and Ramsey County in June had 20,000. That not part of the average, but there were about 20,000 unemployed people in June. I thought you might also find it interesting to understand who is on our unemployment insurance rolls. Not everyone who is out of work files for unemployment insurance, but of those that do in Ramsey County, the demographic looks something like this. Mostly male, 59% are male. That also should not be too surprising since construction and manufacturing are hit pretty hard. Education, 8% of those applying for UI had less than a high school diploma, but 36% did have a diploma. 35% had some college up to and including their 2-year degree, and 21% had a 4-year degree. As for the age, 24% were under 30, 24% between 30 and 39, 22% 40 to 49 years old, and 21% 50 to 59. So it's kind of very evenly spread across. Only 9% were over 60. As for race and ethnicity, 6% were Hispanic or Latino, 71% were white, 7% black or African American, 10% Asian, and finally 1% American Indian or Alaska Native. So for Workforce Solutions budget, in the big picture, our overall funding decrease for the next biennium is going to be about 7.9%, which is 29% less than our funding level over the previous biennium. As for the county levy that Workforce Solutions received, we came in at the 6% decrease that was directed by the county manager's office for both years. The WIB, you will note in your booklets, are incurring the 10% reduction of levy as you've requested over each of the 2 years. In order for us to develop a strategy for dealing with these issues of funding, we've looked at various scenarios over the last 6 to 9 months, including making sure that we were aligned with the county objectives, the critical success indicators that we work with, and the requirements of our funders. So the discussion today is really going to represent our best thinking on how we plan to manage within this current fiscal reality. I'll be addressing our strategies through the discussions of our 2 program areas, mandatory programs, which is MFIP, and then the voluntary programs, which are the Workforce Investment Act programs. So I'll talk about those in 3 areas. I'll talk about the actual cut that we're receiving in each of the program areas, the impact in our vendor community, and what we anticipate will be the impact in our caseloads. So for the voluntary programs...
Carter has a question.
I'm sorry. I just wanted to interrupt early.
Yeah.
Ask you to review the numbers that you just led with, the 7.9% of the
7.9 million is our decrease over the coming two years, and that's 29% less. That amount will give us 29% less than we had in the 2 previous budget cycles.
Okay. As I look at the summary on just 146, can you share with me a little slower where those numbers are coming from?
What page are you on?
I'm on HS 146.
Okay, thank you.
And I just didn't follow those numbers.
Okay, if you're on 146, you said. Okay.
In the Workforce Solutions budget.
Go ahead.
Chair.
Go ahead.
Okay, Commissioner Carter. This is an area where I guess maybe I misunderstood a little bit here. I tried to do a presentation here where we showed our budgets are changing in 2011 and since in 12. So state fiscal year 2012 starts in calendar year 2011. So some of these changes and some of those numbers that we're identifying, to get there, you actually have to look at the 2010 and get to there. So it really is, that was a mistake probably on my part. The number there, the 27 million that you see in 2010 column there, if you take that, off of there. That's kind of how where you get into the, I apologize, that's a confusing piece.
Okay. No, I can see the difference in the numbers there. They just appear to be a little bit different than what I heard. So,
Commissioner Carter?
okay. You were attempting to explain that, but it's okay. Yeah, I think I can rectify.
County Manager Kleinschmidt has it.
Mr. Chair, Commissioners, I just wanted to make sure that I understood it. And really, the comments that you're making right now are painting a picture between 2010 and 12 and 13, as opposed to following from 2011 specifically to 2012. Is that what you're saying?
Yes, because basically what really has happened here is our 2011 number had changed so much that I thought, well, we're not going to see the change to 12 if we don't explain what happened in 11. So therefore, I tried to show it in 11, and I understand what happened here in the process.
It's our attempt to be transparent.
And that's fine. It is clear that you're going back to
Okay.
With that, I'll let you have Commissioner Rettman after that one.
Okay.
Well, I appreciate that you, because I must confess, I called Kathy Capone.
Call her around.
Yes, this is a confession. I called Kathy yesterday, and I went, what the heck? and a few other things. And she can confess if she wants to of how she tried to say, can I come over and try and explain? And I said, no, I can't handle it. So I appreciate your candor very seriously. I'm glad you asked the question, too, because I couldn't. It looked like, in The Wizard of Oz, when the witch is like...
How do you know that part so well?
Yeah. Because it was like I couldn't understand it. And so when I had said no to Kathy, and I probably didn't do it as respectfully, I just went, no! Because I had Julie coming up, and it was more that I think what you said, it was trying to be transparent, but it looked like you had nothing to begin with, and you just slenderized even more and was diminishing into nothing, because I started out on page 150, and all it showed was minuses. Yeah. And you showed on a different page, and it was like where it is. So my hope or wish that maybe we can get something from you in writing that will calm at least some of us down to understand it better, because I think today may not be as fruitful because I still am sort of lost. Is that all right to say? I'm still lost.
We will work on clearing that up and getting something to you. Okay, so where am I? Voluntary programs. I'm going to talk about the cuts to the programs, the impact in the vendor community, and then what we think the impact is in our caseload. So for WIA and state, we're going to be working with a reduction of $950,000 for our adult, youth, and dislocated worker programs. Also in there is the elimination of our Building Lives Fund, and if you will remember, we had an allocation from the state of $100,000 for a 2-year period. We are currently in the second half of that second year, and we know that those dollars will not be reinstated. So those are dollars we will not have access to. The cumulative impact of this reduction is that about 450 individuals, including 170 youth between the ages of 14 and 21, will go unserved. In the vendor community, with federal WIA cuts, we went from 3 WIA adult contractors to 1, from 4 dislocated worker contractors to 2. The number of slots available to clients in both of these programs has also decreased, and we've also decreased the time of one of our consultants who works with us on child support. We have had to increase the time that he spends with us to 50%. In the caseloads, nearly 300 adult and dislocated workers will not receive retraining for updating their skills. Support services such as housing, child care, health care, those will be diminished as well for those who do remain on our caseloads. Some of them will exhaust their unemployment. We may see foreclosure, and some of them may go on to MFIP. With the federal WIA youth cuts, we've decreased our budget for Workforce Solutions and the contractors, which of course translates to fewer slots available for at-risk youth. Sadly, many of these youth will not receive the services that assist them in completing high school, getting their GED, or getting employment or career guidance. I actually feel terrible having to report all of these cuts and the impact. It is our reality, and I just kind of apologize for having to report this. But once our program is full, yes.
Commissioner Reinhardt.
And I think it's important for people that are listening to this that these are cuts that have been passed on to us.
Correct.
It's not a choice to cut some really important programs out, nor could we decide on our own that we were going to do it.
Yes.
And so I think that, for those that are watching, it sounds like we've done something ourselves when in fact it's been done to the county, to the people that are receiving these services, because almost all of your budget is money that comes through the state and federal programs.
That is correct.
For direct services. And so when you're talking about this, this is a direct result of what is happening at the state and mostly at the federal level.
Yeah. Thank you for stating that. That definitely is the reality. And we have taken great pains, and we'll talk about that a little bit later, to sort of minimize the impact on the community with some of the strategies that we're undertaking. So I'll talk a little bit more about that. But, even with this news about our voluntary program, when our caseloads are filled, there will still be some services available. Not all of our vendors in the community get all of their dollars from the state and federal. Some of them have dollars from other funding sources that they have been receiving, and we believe that there will be services available at the Y, HAP, the American Indian Family Center, and LifeTrack Resources as well. In our mandatory program, and that would be MFIP, we're going to have a reduction of $2.9 million over the next biennium. This funding cut actually took place July of this year, and it includes the sunset of one of our most helpful programs, the Supported Work Program, or Transitional Work Experience Program. Counties have been receiving funding to pay salaries at minimum wage for MFIP participants for a period of 10 to 12 weeks in exchange for a good job experience. And for the period of July 1st, 2010 through June 30th, 2011, we served a total of 743 participants in that program. 588 were adults, 155 of them were youth, and I'm pleased to say that 259 of them went on to unsubsidized employment. So it's a very helpful program, and it also helps us with our work participation rate. So we're sorry to be losing that one. In the vendor community, as with WIA, we have both direct services and vendor services, and currently we are going to have to cut our MFIP contracts by about 23.5%. We're also cutting our diversionary work program by 5% and our family stabilization services by 10%. These are, the last two are in-house services. In-house, we also have a contract for assistance with serving the client so that we aren't growing the county department, but we are making use of services that are in the community. We're having to shrink that back a little bit as well. Given the high racial employment disparities in our community, we've chosen to keep both of the disparities projects as whole as possible, the American Indian Family Center and the Y. These are very small programs to begin with. About 200 participants are being served in each. In the caseload area, we anticipate reductions across the board in all grants to all agencies that are providing services, and we think that there will be increased caseloads, particularly because in the mandatory section, no matter how many residents find themselves in need of the services, we have to serve them with whatever dollars that we have left. So there will be increased caseloads. We're also going to be eliminating 2 positions in Workforce Solutions. The expected impact is going to be a reduction in the intensity of services, and we believe we're going to be struggling to meet the performance measures as a result. The funding decrease is not going to allow us to maintain our current complement of staff, nor will we be able to maintain the current level of services in the vendor community as I've just described. And here's what we're going to be doing to adjust our resources. First of all, we're adjusting out of our structure 2 FTEs that have been added for dislocations based on large layoffs. We're also adjusting out of our structure 1 FTE, which was provided by the board for a joint use position for the city of St. Paul and Ramsey County, a job developer who would go between both the city and the county. The city was going to fund that position. Workforce Solutions was going to do the supervision and absorb the overhead. The city is not able to pay for that, and so we are having to eliminate that one from our structure as well. We're also going to be releasing 2 FTEs from our admin area, given our bias to try to keep our programs whole where we're serving residents. So we're taking 2 cuts in our admin area. In the next biennium, we believe that we may have to cut an additional 2 FTEs. We are prioritizing. We're looking at, what makes the most sense for the residents, for the needs that they have. And so we're guided by 2 things. First of all, the CSIs to continue to assure access and outcomes for diverse populations and to continue to help residents meet their basic needs. To that end, we are prioritizing core services over subordinate services. We are services that utilize evidence-based practices are going to be retained. An example of that is motivational interviewing. That's being used in other departments across the county. It is shown to have very good outcomes. We're using it exclusively in MFIP, but next year we will also start to use that in our Workforce Investment Act programs. And where resources are most limited, we are targeting the most vulnerable families. A big change for Workforce Solutions, although it may not seem like it, is that we'll have to be searching for more sources for competitive grants than we have in the past. We've always done so, but now, as a matter of course, DEED and the Governor's Workforce Development Council may be putting out, rather than pushing grants through the workforce service areas, they may be putting them out on a competitive bid, which means that there will be more players trying to go after the same amount of funds. For us, that may mean a lot more administrative support to secure these grants, but we will be targeted in which grants we actually decide to go after, making sure that we're aligning ourselves with our mission.
Commissioner Ortega.
Patricia, when you say it's going to be more competitive, how is that different from now?
Well, now, Commissioner, we get opportunities for competitive grants if there are layoffs. We will get together with our partners and we will, bid on a job, on a project. Now what's happening is funding that might ordinarily be coming down to the workforce service area, like some of the 10% money that DEED holds or dollars that are given to the Governor's Workforce Development Council. They plan to put those out on bid for anybody that is doing workforce work to bid on those. So we will have more than just our government or the counties going after. There'll be vendors in the community. All of us will be going after. We'll all be chasing the same dollars.
So, follow-up question. So there are some of our vendors will be able to directly compete for the dollars.
Yes. That's not totally unusual, but we have very good relationships with them, and we partner with them to say, here's a grant that's coming. Usually that's money is coming to the counties, and we will go to our partners that we know have skill in a certain area and say, will you partner with us on this particular grant? Or they may be in a particular area, or they may have a network to a particular community that maybe we don't have. This sets things up a little bit differently for us. We'll roll with it.
Right. But basically, we should be able to maintain the same partnerships in going, regardless of how they're restructuring this.
I would like to say absolutely yes to that, and we will work to that end. However, our vendor communities are also receiving cuts, and so we don't know how it's going to play out.
That's exactly why I brought it up.
Yes. Not really sure how it's going to play out.
Well, there's the possibility of sort of unraveling of the tapestry here, and I'm just that's why I'm asking deeper. But I don't. I know you. I know your work, but you work well with all our partners.
Yes. I think you're right. I think it is a concern. It is, it's a concern that we've been stating among the directors of the workforce service areas, because we currently have a system that is very well monitored. The state they know who they're holding accountable for the expenditures of those dollars. We're not sure if they start to break pieces off, if the system will remain as strong as it currently is.
Thank you.
You're welcome.
Mr. Parker.
Thank you, Mr. Chair. Well, first of all, I just want to comment and say that it's just, to me, really sad that the state and federal governments are cutting this area during this economy, that it is just so opposite of what's needed right now, that it's really frustrating to hear about all these cuts. And, okay, I've got a couple questions, and they may have to do with what Commissioner Carter was bringing up earlier, and so if it's something that you're going to, okay, we've got on page 151 the 2011 proposed budget. Is that supposed to be 2012? Is that what the question was?
No, but that's a part.
Okay.
Yeah.
Chair, may I answer that question? Commissioner Parker, okay, what the intent of this was to show, and I can't apologize for this, was our 2011 budget is changing based on these cuts that came through, so I wanted to present that to you to show you that these cuts happened in 11, not in 12.
Right. Okay, gotcha.
So the impact is hitting us in 2011, not in 2012.
Okay.
So we have to really adjust, and we're lowering our 2011 budget by these dollar amounts to get, and then we're moving forward into 2012.
Okay. I think now I understand, because one of my questions was that the youth cuts seem to be disproportionate on 2011 to what I saw in the decrease in youth services funding. But it's because it was the two different years I was looking at. It's 2011 is when you're getting the big cuts.
Yes.
In the middle of the year.
Yes, because we don't, technically we don't know what 2012 will be yet. It's still kind of an estimate.
Yeah.
So we know what 2011 is, but that's state fiscal year 2012, which starts July 1st. So,
yeah,
if that makes sense.
Okay. And
Mr. Parker.
I wanted to just comment. Last night I was at the Ramsey County Library Board meeting, and it was interesting hearing a presentation on the employment services that the library is doing. And it occurs to me that we've got two different workforce assistance operations in the county. There's Workforce Solutions, and then there's also the libraries. And what's happening, I think, is that as people are going to the libraries to use the computers, they don't know necessarily how to go about doing the job search. The librarians are kind of filling in to do this, and so they've started doing classes, and they've, kind of to fill the gap. But my question to them last night, and I don't know if you've already heard from Susan, but I suggested that you and Susan and I get together.
Yep.
It seems like we should be working more closely together, that Workforce Solution maybe could be providing services at the libraries, because that's where the people are turning out in hordes to try to get assistance. And when I raised the question last night, I said, why should the county be funding this when we're already funding Workforce Solutions? And the answer was, well, for one thing, the Workforce Solution is so restrictive on only serving low-income people. I don't know if that's true.
Commissioner Parker, the folks that are probably coming into the library are probably the general public. We serve the general public in our resource rooms. So there's no restriction at the Workforce Center on those populations. What happens, though, is that sometimes we're full and people know that they can go to the library. Sometimes the library's full. People know that they can come to us. And they may also be getting a different population. Typically, immigrants that come to Ramsey County or come into the country know about libraries. They know to go to the library to learn things and to get onto computers. They may not know about the workforce centers. Now, we are in a number of libraries across the county with services, with classes. They could talk with the counselor, but these are not clients that are basically on our caseloads. This is the general public. And is there duplication? I don't know. We have an intentional effort to start working with the libraries because in terms of general public, we know we are seeing the same people. So if they can help us and we can help them, we think that it just helps the citizens. It just, so there probably are some similar things at the libraries that we have at the workforce centers.
Okay, and one of the other responses to my question was that your hours are much more limited than their hours.
That is true.
And so people will go, weekends and evenings and, where you're not available. I think that the libraries are a resource that can help, maybe soften the blow of some of these cuts, so that people are still getting the services. But I really hope that there is going to be more working together so that it looks more seamless rather than, okay, the county's doing this over here, and then the county's also doing this over here. And so people would see that there's more of a collaborative effort.
Commissioner Parker and Commissioners, I would add that the Minnesota Workforce Council Association has been working with MELSA, which is the Minnesota Library Association.
Metro Library.
Okay,
Yeah.
to try and do just what you're saying, to try to see what kind of resources we can in common provide that is not a duplication, but really a leverage for each other.
How many computers do you have at your workforce center?
Centers.
Centers, plural.
About 20 for the general public at each workforce center.
Okay, and there you go. Roseville Library has 133.
Can we have some?
Well, but see, it's we is the royal we. We do have those.
Yeah.
You know?
Yeah.
And people should be directed to be able to use those because that's what they're for.
Mr. Reinhardt, then Commissioner Brett.
Well, and I think in reality that is what's happening, and so to have a more concerted effort to make sure that everyone is aware hopefully what they're trying to do through MELSA. But it's important for us to note it here as well, because people are going to the workforce solutions, workforce centers, but everyone that I have talked to that is job hunting, the library is a major source of information. And so that's how they're using them. How can we make the best use of that, I think, is really the question.
Mr. Chair, the libraries in both the suburbs and the city, as well as some of the, some rec centers actually also have them. But can I just ask a question, since Jan brought this up, and it's not in regards to budget, but more in terms of, is there a, and I'm not technologically the most savvy person, but isn't there a bookmark or something type of thing that even if you had that on the county libraries or the city libraries, that would take it directly to the workforce?
A link?
Yeah, a link. Because I think that's one of the things when people, you know, and again, I could be saying all of this wrong. I'm not saying that you can go to it real easy. At the Ramsey County Libraries and at the City of St. Paul Libraries, if you want to look up a book, you can type in, you know, fluke, and it'll come up with the books written by that particular author or something like this. And if you had something very similar, if you're looking for the work types of things. It's just a suggestion, because it's like, if we know that that is going to happen, and I think that's Jan's point, is that the libraries are seen as the place to be, is how do you make that equal, that access as seamless as possible, because it is Ramsey County, as Julie says, Inc., rather than just, it's not a duplication. It's like wherever you can get to, the services there.
Yes.
Okay, go ahead, Pam.
Okay, I'm going to move over to talking a little bit about what opportunities we see in this fiscal environment. But the first line really is about partnerships, and I just thought I'd mention that we have some partners that came just to be supportive, and it is representatives from the American Indian Policy Center and the American Indian Family Center. And I just wanted to acknowledge that they're here for the board and to say thank you so much. I just got word yesterday that it was their intention to come here and to be supportive, and they are managing one of our disparities projects for us, so I really appreciate that they're here. But I did want to say that in terms of opportunity, that's one of the greatest opportunities that I believe that we have at Workforce Solutions, and that is to maximize and increase the partnerships that we have. And I'll just mention one. We have a partnership that we are developing, ready to kick it off, and it's called the Father's Care Partnership. I think it's very unique. It is a partnership between Child Support, Workforce Solutions, Goodwill Easter Seal, and Summit Academy OIC. This is not costing Ramsey County money. What it is costing us is the time and effort to facilitate the partnership. The goal is what we know is that families, the best way to get a family off of MFIP is to have a second income coming in. And so our goal with this program is to train fathers in some real hard training, some hard skill training, but also to train them in the relationship area, how to be a good father, how to be a good partner. And so Goodwill Easter Seal has that as part of their expertise. And so Workforce Solutions in the MFIP side is pulling this partnership together and has been working with all of the partners to try to affect that. It's something that I'm very proud of. We're also working with corrections to provide job-seeking skills to ex-offenders, and here's a case where our expertise is pairing with corrections needs. We plan to continue to focus regionally and to even do more of that. The Workforce Service Area Director in Minneapolis, and I meet almost monthly just to talk about what are some opportunities that are out there that we can go for together. Of course, we have Renew, but we are now talking about an H-1B technical skills grant for manufacturing and healthcare. We think that that's really a way to leverage resources. We will continue to seek service delivery innovation like the children's mental health worker that you approved earlier this year, where families are being co-managed by a child psychologist in human services and employment guidance counselor and workforce solutions. We're also going to continue to focus on racial employment disparities with the American Indian Family Center, NITCAD, which is the Network for the Development of Children of African Descent, the Blue Ribbon Commission, and the Y. And we are working towards eliminating duplication of services. We think that we are not going to be able to afford one-on-one counseling anymore. It's a very rich way to work with people, but we are looking at a service delivery model that makes use of groups and makes use of the adult learning model. So we're just in the beginning phases of that we will never be able to eliminate, and nor will we want to eliminate one-on-one. But what we can do is expedite a person's readiness by working in cohorts, and then a trained job counselor can actually target and focus on, here's what you need to do next to get a job. So that's a big thing that we're starting to work on. We're going to be relying a lot on evaluation and best practices research, like the motivational interviewing, which I mentioned earlier, services to teens, which we know has excellent outcomes. I have down that we're going to collaborate more with libraries, public health, child support enforcement, corrections, CHS, of course seeking competitive funding, and then focusing on high-growth industries like the partnership we have with the Met Council for the LRT Works, Renew, healthcare, and those high-growth industries that are targeted by the WIB. And then I'll end by just having just a brief discussion about the BRC, the Blue Ribbon Commission. I had hoped that by today the report would be out and I'd have a little bit more to say. The report will probably come out this afternoon, and it's only going to be a draft. We'll have a draft this afternoon, then that goes to the Blue Ribbon Commission, and the members will, give input. It'll get finalized. It'll go through the various committees at the WIB. It will come to the board. But we had 20 individuals that were highly motivated. 3 foundations were at the table. The members actually said at the last meeting that this was an excellent experience. They were pleased with what they had accomplished, that when they first came, they were hoping it would not be something that they would do and then get put on a shelf, and they have every confidence that that is not going to happen. They are going to be looking for where we can make sure that there is accountability. They have a very strong desire to see some action following the report, and I believe that the action is going to target business, government, schools, the WIB. It's going to be across the areas where there are issues. And the final recommendations, when those are in, CHS's evaluation unit will create a set of measurement criteria to help us to determine if we are actually, how we're doing with the strategies, and a formal report will then come to the board, the city council, and to the WIB. And that is about as much as I can say on that right now. So
Well, let's see if there's any questions. Commissioner Redmond.
Not on that subject.
No.
On workforce solutions.
Right.
Okay, and I'm not gonna I'll defer to you. No. Do you want?
No.
Oh, okay.
Let's just let her go.
I'm not going to say how many questions this is going to be, but I'm just going to try and.
We've got a number.
If I say
down.
a number, then they hold me to it.
The chair has the number already in his mind.
Yes. I'll give you the easiest one first. Okay. On HS 152, this is the one number 11. This was the one you were working on, the nurses, and now I know this is the returning to yesteryear, but it said in 2011 you were going to try and get more money of that coming in, and it doesn't show up in 12 and 13. Is that meaning that it continues or not, or it went away or not, or what?
That means that if the dollars become available, we will apply.
But this is for 2011. This was the proposed...
We do not have those funds.
Okay.
We don't have that 99,000.
It was proposed to be with negative, and so have you already applied for the funds in 11?
In 11, I don't think we have. No.
That was actually, Commissioner Redmond, that was actually, if I remember, Kate, that's a 2-year grant. That was to cover 2 years, wasn't it, Kate? That grant, this particular grant, the grant period, the grant cycle of that was 2 years, I believe, as I recall.
Here comes help.
Yeah.
Please identify yourself.
Kate Probert, I'm Operations and Direct Service Manager for Workforce Solutions. It is
And your name is?
Kate Probert. It is a 2-year grant. However, you can spend money within the 2-year period, so you don't necessarily have to attribute and send money aside pre-yearly. It's a deed is overseen on the grant, so we connected with the deed, and since we have participants who really would like and benefiting for training, and we currently also have partnership with employers who giving them on-the-job training opportunities as well as job placement opportunities, we have started spending money at the faster rate. So we're pretty much going to be closing down in the next couple of months. And then we will be go ahead and reapply, maybe with the same program or different program, because it is driven by what is hot job market out there. And we're hoping to reapply for this grant again with MJSP, and we may or may not get award.
Thank you.
Mr. Chair, the reason why I asked that, because it did seem like one of those, and I know that you wanted to do that a lot.
Next question.
Now, wait just a second. We're running on time, so...
I'm going to lose another member shortly.
Is that a personal thing, or...?
No.
I better get back to the questions.
But you'll be speaking to an empty house.
When you redo this, so that it makes it clearer, one of the things is, like on page 150, you sort of show all the negatives and you don't have the baseline and things like this. Can you sort of keep a theme all the way through it so that we see the same, like we are youth, all the way through when you're asking it, so that, because some of them get collapsed in subsequent years, and so then we can't figure it out, or I can't figure it out. So it would be, if you're going to have to redo this, it would help a lot, because otherwise you're going to get questions in written form. I do have a specific one in terms of page 155 and 153 under WIB support. Now this is under the 12 proposed, not the 11 proposed. It says, the last sentence says, in 2012, the total WIB allocation from WIA dollars was decreased by 30,000. Okay? But then on page 55, number 19, the last sentence says, in 2013, the total WIB allocation from WIA dollars will remain the same based on the projected WIA grant for 12 and 13. Are those...
Chairman, Mr. Redmond, that basically, again, that's because we don't know what the change will be between the 2 years, so we just put the same budget in for both years. So 12 and 13 show the same budget, so therefore the WIB would get the same percentage of the total. That's why there's no change.
So can you put, sort of show how much WIB is getting from WIA as well as levy? Because the levy's the reducing, but it also sounded like WIA was reducing also, but you're not sure.
It decreases in the first year. We have that number
In 11
disclosed in here.
or
but
12?
It's decreasing in 11 because that's the year, that's the budget we got, but we don't know what 12's
And see,
award is
that-
going to be, so therefore I can't disclose what.
Okay.
Commissioner
All right.
Redmond?
I'm going to have to see when they get all this done, and then I'll write you long letters.
Commissioner Carter?
Didn't say.
Thank you, and I do realize how difficult it is within the changing environment to nail this, especially with what's happened in 2011. But I look forward to seeing the more definitive information coming forward. I did want to mention that based on the description and the conversation we've had right now at the table, you have been talking about a area of services that really is moving more and more toward delivery through partnerships. And that means some of the centralization of our work going away, but a real focus on standardizing and being able to educate and communicate and work to understand best practices and evidence coming out of practices with our partners so that we can understand the impact of our work. To me, that suggests some changing configuration in the future of your the jobs that you actually have supporting some of this work. Is there any thinking that you might share with us about what we may be moving toward in terms of a model that we would want to consider for this work in the future? It gets very difficult to deliver it in a centralized fashion with everyone coming to us with the resource reductions that we have seen. But we certainly want to manage the standards and two best practices and understand the results of our work into the future. Should we be necessarily sustaining in this kind of environment? Can you talk a little bit about what your assumptions are about what that could look like?
If I'm understanding you, Commissioner Carter and Commissioners, we are currently in discussions with some of our partners at the state and other workforce centers in the other workforce center in Ramsey County and in Minneapolis and Deed, with talking about a service delivery model that makes more sense for this economy and makes more sense for the large number of clients that we're seeing. It certainly is partnership based. What we would be looking at is all of maybe the workshops that we do, maybe being delivered by a college, some of them being delivered by college, some of them being delivered by job counselors who currently are not delivering workshops, but being done in a way that we're also partnering not only externally, but with each other to provide a core set of skills to a client who will probably still need some one-on-one, but we're hoping less one-on-one in order to get them ready for a job, And we're looking at doing that across all the program areas, MFIB, WIA. There are some models that are bubbling up around the country now that have this very thing I described as a basis. And so we're hoping to also learn from that. So we're doing the research, we're doing the meetings, we have what we think is that concept that I just described. We have not put any flesh on that yet. But we know it's a necessity for our future.
And so, to follow up, and so as that proceeds and as that becomes clearer, do you anticipate then returning to the board with a description of what the evolution may be and how you are preparing for that evolution?
Yes.
I do agree that, this is a different environment, and we need to be very, very deliberate about how we change, and I'm glad that we're looking at it throughout the metropolitan area and partnering throughout the metropolitan area. But I do think it could be some pretty substantial model changing for us, and that it would be helpful to understand as that occurs what in fact you're envisioning for the future, helping us to focus our resources to accomplish the best objectives across the board. So thank you very much. I'll look forward to hearing more.
Appreciate it.
Any additional questions? If none, thank you, Patricia.
Thank you.
Anything that anybody wants to bring up for the good and order?
So are you going to work all weekend doing this? He didn't hear me say that.
Are you talking to Mark?
I was talking to y'all. You're going to work this weekend and
Oh, yeah.
give it to us
Oh, yeah.
first thing Monday morning?
Starting right now.
With a little bow on it.
Today? Well, our next meeting will be the 6th of September, where we'll hear the HRA and the Regional Rail Authority budgets after the regular board meeting. We'll also have our public hearing, the first one, which will be at 1 p.m. in the courthouse. Those of you that are out there that would like to speak, you need to sign up either ahead of time by contacting the clerk, and her phone number is up on the screen as we speak, or signing up the day of it. People will be taken in the order that they sign the sheet, and they will be given up to 3 minutes. And after that, we have another public hearing on November 28th, which is a Monday, at 6:30 p.m. at Roseville Area High Schools, which is located at 1240 County Road B2 West in Roseville, Minnesota. That's between Lexington and Hamlin, 1st Street north of Highway 96. I think that just about covers it.
And you're going to let us know when questions are due.
And I'll let you know when questions... Kathy will.
Memo to follow.
Memo to follow.
Thank you.
Hearing nothing else, this meeting is adjourned.